St. Charles Health System confirmed today it's preparing to issue $100 million in bonds. Ariel Brumfield spoke with the chief financial officer and has details about how they want to use that money. Ariel?
Lee, this new bond issue will help St. Charles with improvements for both the Ben and Redmond hospitals over the next 5 years. St. Charles is preparing for a bond issue of $100 million to benefit a number of projects for both the Ben and Redmond hospitals. Some of the planned projects include expanding oncology services in Redmond with a new cancer center, in addition to consolidating some clinics for a new medical building. St. Charles Ben will undergo improvements in its operating rooms and catheter labs, along with buying more land so the hospital doesn't have to lease property. St. Charles Health System Chief Financial Officer Jennifer Wellender says they last issued bonds in 2016. That new debt of $75 million went towards constructing the new patient tower in Ben, in addition to updates in his primary care clinic. Wellender says St. Charles Health System had plans earlier this year to issue bonds, but the pandemic delayed those plans.
So this had been our plan. And so we now feel that we understand how to manage with COVID. And so we are now rebooting much of our normal operations.
Wellender said the hospital system just started to break even again at the end of August and is hopeful the stability it's seen in the last 2 months continues through the balance of 2020. The system has another 2 or 3 weeks of planning before finalizing the bond issue. The final decision depends on market conditions, but the transaction is expected to be completed by October or November.
So if something were to become highly volatile in the next day or two or week or two, we can change our plans and would change our plans and would adapt.
The Deschutes County Commissioners are acting as the hospital's funding authority. Next Wednesday, they'll hold a hearing on the bond issue. Lee, back to you.